Eye cataracts and otitis externa by me, Jerome Montero. Cataracts, the background. Cataracts is the clouding of the lens, which would then cause a decrease in vision, faded colors, and also blurry or double vision, also called diplopia. It can also cause halos when you see bright objects, and also night blindness. The clouding is caused by the accumulation or clumping of proteins or pigments in the lens, which block light from entering the retina. Cataracts are also caused by aging, but can also be caused by genetics, trauma, or radiation. So if you have a family member with cataracts, you are more likely to inherit that. Also, cataracts can also be caused or happen in birth. Cataracts are also so commonplace is that they cause half of all cases of blindness and 33% of all visual impairments worldwide. So how do you check for cataracts? Or how do you diagnose it? Most simply, you do it through eye examination. You do this through checking the clarity of the pupil or sclera. In this picture, you could very clearly see between a normal pupil and sclera or eye versus one with cataracts. The eye on the left you see is extremely cloudy. You can't even tell the color of the pupil or the sclera or iris. Next is the risk factors for cataracts. People who are at risk are people with diabetes, frequent tobacco users, prolonged exposure to sunlight, so you got to make sure you don't stare at the sun, and also alcohol. So what are your interventions or ways for you to treat cataracts? Most commonly is cataract surgery, also called lens replacement surgery. It is the removal of the opaque lens or cataracts and then replacing it with an artificial intraocular lens. Removal of these lenses is done by either emulsification or breaking up of the lens or by simply cutting out the opaque lens. After that's done, you replace it with the new intraocular lens. Another way to use an intervention would be to reduce the risk for fall. So let's say that the patient cannot get cataract surgery. The next best step would be to reduce the risk for fall. Since they have difficulty seeing, they are at much higher risk for falling. So how do you do this? You make them wear non-slip shoes with good support, and of course removing any slippery objects or spills that they may fall upon. Now how do you prevent cataracts? Of course, wearing sunglasses when it's hot and sunny out so you could protect your eyes so they're nice and healthy, and of course not smoking and also drinking in moderation. Next we have otitis externa. The background. It is also called swimmer's ear. It is also the inflammation of the ear canal. It can be acute, which means it lasts less than 6 weeks, or chronic, lasting more than 3 months. Typically, the acute otitis externa is caused by bacterial infection. Meanwhile, chronic otitis externa is more caused by autoimmune disorders. Children are also more susceptible due to immature immune systems and their immature Eustachian tubes. This is why you see children typically having otitis externa much more frequently than adults. So how do you check or how do you see the signs and symptoms of otitis externa? The most common one is ear pain. Whether they're sitting down doing nothing, there's pain in their ear, and that ear pain can be aggravated when they move or touch the outer part of the ear. Of course, there will also be swelling or inflammation around the local area, And occasionally, there's also decreased hearing. And if the otitis externa is more severe, there may be presence of fever. And also, there's usually a presence of exudate, pus, or drainage. So how do you diagnose someone with otitis externa? Most easily, you do it through ear examination. If the ear canal appears red and swollen, just like in this picture, that is the most telltale sign of otitis externa. The ear canal may also appear scaly or shedding. Touching or moving the outer ear also causes even more ear pain, which is actually one of the more common ways to diagnose it. And of course, if there's presence of drainage or pus around the outer ear, that's also another sign. So how do you treat, or what are the interventions for otitis externa? One of them is to apply heat locally onto the ear for 20 minutes 3 times a day. You do this so you would introduce or increase the flow of blood to the area, allowing for better drainage, allowing for more red blood cells and white blood cells to the area, therefore speeding up the healing. You also, of course, want to encourage bed rest and also make sure that you want to use the use of antibiotics and analgesics as prescribed, and the ear should also be clean, free of debris, and most importantly, dry. You want to avoid using Q-tips too when cleaning it. You don't want to use Q-tips when you're putting it into the ear canal. It's okay for the outside, but you do not want to use Q-tips for the ear canal. And now, of course, another intervention is using earplugs when they are swimming or cover the ears when they're showering. Again, you want to make sure that the outer ear is dry. Now, how do you prevent it? You should prevent it by avoiding inserting anything into the ear canal like cotton buds or swabs. If you are to clean your ear canal, you should only use it maybe once a week at most with a Q-tip. Ear canals, or our ears, naturally have their own way of cleaning themselves, so using a Q-tip is actually unnecessary. You should also wear earplugs when swimming, as I've said before, and avoid swimming in polluted water. Now that sounds very obvious, but in countries like the Philippines, polluted water is very commonplace. And swimming it, you see many kids swim in it, and you do not want them to swim in it. That very much increases their chances of otitis externa, or just ear infection in general. And that's it.